So there's this term that gets thrown around a lot, which is the art of medicine. And it really is such a critical term within medicine because the art of medicine is the heart of medicine. It makes a difference in how patients are cared for at the end of the day because it's the skillful application and practice of knowledge that turns medicine from a basic science into an art. And so as a practitioner is actually able to make a skillful applied application of that medical information, that's what differentiates that healthcare practitioner from a medical textbook or a Google search engine. And how important is it to be able to actually take medical knowledge and apply it in a skillful way when a clinician only has, for example, 15 minutes to see a patient? That short visit, they have to acquire and assimilate a whole host of medical knowledge in order to make sense of a patient's context. In that short 15-minute visit, you have to consider diagnoses, you have to acquire information, you've got to assimilate that information, and you have to make use of that information to come up with a holistic picture of a person as a person within their environment and within their medical context. So it's a huge task. And as a physician, we can approach the problem by becoming more skillful in how we acquire that information. We can be better at how we ask questions and how we approach problems. So one example is if we look at a patient with diabetes. One of the major complications of diabetes is a complication known as peripheral neuropathy or loss of sensation in the feet. When a patient loses feeling in the feet, they lose the ability to protectively sense the bottom of the foot. And in doing so, they actually lose the ability to identify when they're hurting themselves. They can develop ulcers. Those ulcers can go on to require surgical intervention, and some of them go on to require amputation. It's estimated that about a quarter of all of diabetics will develop ulcers in their lifetime, and of all ulcers, about 1 in 5 of them go on to require amputation. And so it's really critical from a primary care professional standpoint to be able to identify patients who are at risk or who are affected by this condition so that they can be managed appropriately. So some questions that a physician might ask a patient include, do you have numbness or tingling in your feet, or have you lost sensation in your feet? Which seems like a pretty reasonable, direct question to ask a patient. The problem is that many of these patients lack the ability to even understand that they have lost sensation in their feet. They don't even realize that it's happened. They could step on a nail and go for days with that nail in their foot without even recognizing it. It's a problem that's pretty subversive in that way. And so there's another example of a question that could be asked that actually helps to deduce more information from the patient. And one of those questions is, when you're in the shower and you close your eyes, do you lose balance? And it's amazing how much more sensitive this question is at being able to pick up symptoms of peripheral neuropathy or diabetic foot disease than some of those questions that might seem more direct. And so this is an example of how the art of medicine really plays into the practice of medicine. Knowing how to ask the questions and which questions to ask enables a clinician in a short period of time to be able to collect or not collect the critical information that they need in order to effectively manage that patient. So the problem is that no matter how skillful you are as a physician and no matter how much you know, there's only so much that you can collect in that short 15-minute window. There's only so much history taking that an individual can do. There's only so much physical examination that an individual can do. There's only so much test taking or test ordering that a physician can affect. So what if we could do this in a better and more efficient way? So the question is what if we could actually take smart devices and smart tools to enable that practitioner to understand a concept of what it is to be that patient and what their daily living has been like and their experience in health or disease since the last time they were seen in that clinical context. So this is exactly where there's such a promise in terms of wearable health and the connected self or connected health. We can actually use devices to be those data collectors for us between those visits with the physician. And in doing so, we can start to deduce really interesting information and start to understand a disease a whole lot more. So the ability to not rely on a patient to remember all of the critical details about their experience over the past 6 to 12 months, or not relying on a clinician to be able to deduce a lot of information in a short period of time, is something that these devices can offer. And that's really the exciting area that this space is. So in recognizing that we can take these wearable technologies and start to actually bridge the gap between visits and fill in a fuller picture of a patient's life with a disease, I co-founded a company early on in my residency in plastic and reconstructive surgery to develop this company. It's called Orpix Medical Technologies, that would create technology to enable this. So at Orpix, we quantify health by the swing in your step. Now, what does that mean? So we've created a proprietary platform. It's a foot sensing platform that incorporates a number of different sensors on the foot and takes in data in real time to basically map what's happening with that foot. So we can take pressure sensor data, we can take accelerometry data, data from gyroscopes. There's a number of different sensor inputs that can be used that can be pieced together to essentially weave a picture of what's happening on the foot over time. So this is just to sort of abstractly represent the collection of data. This device, in one of its forms, has about 20 sensors that collect data at a frequency of 100 hertz, so 100 measurements per second. So we end up producing about 2,000 measurements per second, which ends up leading to about 120,000 measurements per minute, or 7.2 million measurements per hour. So a huge amount of data is collected on the foot in real time on an ongoing basis. And it might seem that this stream of data is useless and meaningless. Why would you want to collect so much data from the bottom of the foot? Well, the reality is we have to think about this again, because if we take that data from the foot and we can map a picture of what's happening on the foot, we map a picture of your interaction with the world around you. And so that picture is so critical because your foot is really the grounding for most of what you do. And it takes a bit of thinking about it to realize how much potential a device like this has. A device like this could be used, you could use GPS data, or you could use a multitude of other sensor data to seam together to identify where you are in the world. Locationally, where are you? We can also use complex mathematics and machine learning principles to start to find patterns in that seemingly random data to be able to come up with algorithms that can identify very interesting things. So information, data then translates to information, which is basically provides meaningful answers to questions that might be posed. So the device, based on how your stride, how you take a stride with your foot, and how that foot plants on the ground, we can start to look at things like how tall are you, or how much do you weigh. When you take those pieces of information, you can start to calculate other things like what is a patient's BMI, or just by how somebody interacts with the ground, we can identify gender, for example, or how old someone is. All of these things can be taken together to start to seam together a picture of you and your health. Now, if you start to, again, take multiple pieces of this information and tie it together, you can start to identify how much energy expenditure a patient is having, so how many calories they're burning. And then beyond that, we can not only quantify how much activity someone is doing, but by looking at those unique patterns on the bottom of the foot, we can actually start to deduce what type of activity you're doing. Are you standing, sitting, walking, running, biking? Because it's all typified by different patterns that you see on the bottom of the foot. And so in doing that, we've created a tool that arguably is the most powerful fitness monitor that's been created, because we're really rooted where most of the activity happens on the body. And so when you take this footprint of data, what's interesting is that that footprint is unique to you. That data is like a fingerprint. And so of a crowd of people, or of a population of people, we're able to identify that you are you of a larger group. But also interestingly is that if we have a baseline understanding of that sensor data that's coming from your foot, we can actually start to identify states when you are not you. And so an example of this would be you deteriorating into a health or a state of not being healthy or being sick. And so identifying not only those differences from you on a population level, from you to different days as yourself, is a really critical and powerful tool. So as we move about our world, we can collect this data and we can start to really glean interesting pearls of information about people. You could identify how closely you golf to Tiger Woods. You could identify how closely you skate to Sidney Crosby. And you could identify how closely you play basketball to someone like LeBron James. So we can deduce these interesting things, or we can transform healthcare. And that's really our focus. So in my earlier example, I talked about diabetes and peripheral neuropathy and the problem of not being able to feel your feet. This is a massive problem, and this is our key focus area right now. So just to quantify how big the problem is of not being able to feel your feet, it leads to a limb being lost every 30 seconds. So contrast that to every 30 minutes is lost due to a landmine. So it's a massive problem, and we're currently addressing it in a very reactive way. Now, with diabetes and diabetic foot disease, just by the way you interact with the ground beneath your feet, we can start to look at different patterns that might indicate how severely you can or cannot feel your feet. So the tool could potentially be used as a diagnostic tool in that way. Similarly, based on patterns we see of pressure on the bottom of the feet, we can potentially start to guess at areas that might be prone to ulceration and intervene on a real-time basis to help patients prevent things like ulcers and tissue damage before they even happen. This is just one example, and there are many other examples. So another example of use of the system in a very different context is within the management of heart failure. So one of the key tenets to the management of heart failure is for patients on a daily basis to weigh themselves and track that over time to identify when they might be gaining weight, which might indicate that they've been retaining fluid and that their heart might not be functioning properly and that perhaps they actually need to be seen by a healthcare professional. Now, a device like this, if we take that sensor data in a different way, we start to empower the patient to actually be able to collect that data without even thinking about it. The device does on its own. And in doing so, we provide the patient with the opportunity to almost forget about the fact that they're managing this condition and have it prompt them when a problem exists. Another potential application of the device is in identifying conditions that might have implications on gait and balance. And one example of that is Parkinson's disease. So again, if we know a baseline of how well somebody's walking with Parkinson's, then we know we can start to actually identify when they veer off of that normal for them, when their fingerprint changes. And so the possibility exists to use a system like this as a tool to help titrate medications in different contexts. Similarly, there's a phenomenon with Parkinson's disease known as freezing of gait, where patients will actually get stuck in positions and feel extreme hesitation in terms of moving forward. So a device like this could potentially identify those stuck patterns so that it can prompt the patient on a real-time basis to actually move and help them manage the disease on an ongoing basis. The possibility extends even further, and we can look at a system like this to monitor conditions like mood disorders and quantify how activity patterns might change over time and how those might reflect underlying mental status. So the promise of wearable technologies is really massive in terms of the ability to start to prompt primary care or emergency care in an on-demand fashion, which is critical in a situation where we need to start actually deinstitutionalizing medical care. We need to create ways for patients to be able to manage themselves if we want to create a sustainable healthcare future. So this picture here is of a pedometer that was a freebie pedometer in a cereal box, a Wheaties cereal box of the 1930s. So the problem with wearable technologies today is that new fitness monitoring devices provide very little incremental value compared to what you could have received in a cereal box 80 years ago. And so we really need to start pushing the envelope in terms of what wearable technologies can do. And start to actually look at very meaningful applications within the healthcare world. So we really live now in an era of the democratization of data. And what that means is that patients or people on an individual level can be empowered with these wearable devices, with these connected health devices, to collect data on their own and manage their own disease processes. But what's really, really interesting here is that patients can not only start to understand their own disease better on an individual level, but on a system level, we start to actually crowdsource the data that's collected from these devices, and our ability to understand disease transforms. As we start to understand disease on a broader scale, we can create more preventative ways to approach disease, which is an extremely exciting thing to be a part of. So as we see that framework within health change from more of a reactive care approach, as we're currently practicing, to more of a preventative approach, this framework becomes more innovative, more intuitive, and really more efficient. And so I think that over time we're going to see that the walls of traditional healthcare institutions are going to start to crumble away, and they're going to make room for this new healthcare that's extremely exciting and really in patients' hands. And I think that the most exciting part right now is that we can all be a part of it, and we can really be pivotal in that transformation. Thank you.